Okay, looks like everyone's getting in here. So if you guys could hear me and you could see this handsome guy over here, Dr. Hashimoto, and you could hear me over here, I just want you to just type yes in the box. Okay. All right. Looks like we're ready to roll. So today we're going to be talking about stem cells and other regenerative medicine techniques and how this can actually potentially eliminate the pain in your neck, back, shoulder, hip, knee, ankle, and other pain conditions. You're also going to learn what's on the horizon as far as autoimmune conditions, multiple sclerosis, rheumatoid arthritis, psoriatic arthritis, and other diseases and counting, and without the side effects from medication or risky surgery with no guarantees. So we're going to be discussing all of that today. At the very end of this presentation, you'll have the opportunity to get a free PRP, Platelet Rich Protein procedure, and I'll explain what that is later on during the presentation. All you really need to know is that we use growth factors from your own blood to treat joints, tendons, ligaments, muscles, or even for aesthetics to eliminate pain. And I'll explain that in detail later on. So you'll get that for free. Partway through this presentation, you'll see a button to schedule a free phone appointment. When you schedule that, you'll be eligible for that. And I'll explain more about that at the end. I have a lot of people that ask a lot of questions, and I just want to kind of answer some of those at the very beginning. So we have a number of the people that are going to ask is like, will this work? I'm 88 years old or 93 years old. Am I too old for stem cells or regenerative medicine? And the answer is typically no. It's really just depends on your condition. Joyce over here. She had pain when she went to church, so she couldn't kneel or stand for too long because she had a lot of arthritis. She was really getting to the age where doing a total knee replacement was kind of questionable, and she just was told that she should try and avoid it. And she came and did stem cells, and now she's kneeling and standing in church, and she's happy. We have Glynis over here. She had difficulty getting down and playing with her grandkids and traveling, and for her, she worked hard her whole life and got to retirement, got to her golden years, and realized that she couldn't do all the things that she wanted to do. She did not want to go down that surgical path and decided that she was going to try this, and she was out of pain. She's referred a number of friends, and she's been very happy, a big advocate, and she did one of her TV commercials. That's where these pictures are coming from. We got Tony over here. We managed his knee pain for many years using things through his traditional insurance like his Medicare. He did very well for a number of years, but eventually it got to the point where those procedures weren't going to help anymore. And we had to do stem cells to get rid of his pain, and now he's happy again. And if you want to, a lot of our providers take a wide variety of insurance. That may be an option for you also at the end. And then we have Deanne over here who had muscle and joint problem and did very well. We have a couple of autoimmune people. Laura over here had rheumatoid arthritis, pain all over her body, and fibromyalgia. She did very well with that procedure. And then we have a psoriatic arthritis and a back and a hip pain person over here. They did very well. And then a standard hip. Most of the people we treat are hips, knees, and shoulders. We do a number of backs, and that brings me to this next case, which was a really bad back case. And I'll share this, and then I'm going to tell you more about how we treated these people throughout this presentation.
I've had back problems for the last 25 years. The older I get, the more serious the back injuries feel, the pain and suffering. And a couple years ago I had to quit golf because of my back, and last year I went through and I had the steroid injections, 4 different injections. They didn't work on me. I've had many acupuncture done down here in Palm Desert and up in Portland, Oregon, where I live. November last Thanksgiving, it got so bad that my pain level was like a 1, from 1 to 10. I couldn't get out of bed without my wife's help. I couldn't do the bathroom deeds without my wife helping me off and on the toilet. It was embarrassing, and it was, I was in pain 24/7. I spent 2 nights up against our refrigerator standing up trying to get relief so I could sleep for a little bit standing up. I don't know if you've tried that, but that's not a walk in the park. Then I got to the point where my quality of life was just nothing. And it bothered me just opening my eyes in the morning thinking about what I was going to go through during the day. And I talked to some surgeons regarding back surgery and the condition of my back. They didn't give me much hope that I would get the kind of relief that I could get around and function and drive my car and be able to walk around the house without pain. Then a neighbor of mine gave me Dr. O and Dr. H's stem cell book. I read the book. My wife and I talked about it, and honestly, I felt I have everything to gain and none to lose. So I come in, talk to Dr. H. He looked at the MRI and the x-rays, told me the kind of procedure I'd be going through, and that was first part of February that I had the procedure. And they told me it would be probably 4 months, 6 months before I really felt it. In about towards the end of May, the excruciating pain, I wasn't having the spasms. In fact, every day it seemed like it was just better, and I would come down twice a week and do the therapy, and I think that probably had something to do with it. But it just pretty soon I stopped even thinking about having the bad back. Last Friday I went out on a golf course for the first time in 2 years, played golf with my buddies, and I just got to tell you, the procedure itself is a walk in the park. I think the time I spent in the clinic here, them doing the extraction, and then it was a 2-hour wait, and then I had the procedure done as far as the injection. There was no pain, nothing compared to the steroid shots that I had. I can just tell you life's good.
So if you want to learn how to have more stories like Gus or some of those people, I'll be sharing that with you in this presentation. So my name's Dr. Hashimoto. I'm the author of Demystifying Stem Cells, a Real-Life Approach. I'm also co-authoring a new stem cell book, Forbes book, which will be released soon. Orthopedic injuries are our specialty, but we've treated a wide variety of conditions. I'll also be sharing what's on the horizon with treatment and what others are doing for treatment throughout the country. I'll also be sharing what others, patient health centers, doctors are offering for treatment throughout the country. So this presentation really is for you if you want to know if you could avoid surgery. Even if you've had surgery, this presentation may be for you. We do treat post-operative pain quite often, and it's really a case-by-case basis. If this presentation is for you if your joints ache some of the time and you're 100% positive you don't want to go down this surgical path and you want to prevent that future surgery. This presentation is for you if you just want to know what's on the horizon for things such as autoimmune conditions and neurological disease. And this is for you if you just want to learn more about stem cell therapy and what it can do and what it cannot do for a loved one or a family member. Why is this important for you now? Well, most doctors do not understand what the full benefits of stem cells really are. A lot of them, well, none of them are really taught about this in medical school. They don't know what it can do, what it can't do, and unless they have their own problem, they're not really going to research this on their own. Take seminars and courses and stuff like that. Most do not understand the different sources, and most of the people do not understand that none of these come from aborted fetuses, especially in the United States. Most do not realize how effective this is and why others fail. We have people that say, well, this worked for bone-on-bone arthritis, and it's always a case-by-case basis. We have to take a look at what people's definition of bone-on-bone arthritis is. And most of the reason why I see others fail is that they just didn't deliver enough stem cells into the area. And if you deliver the adequate amount and do the appropriate procedure, you're going to get a good result. Most do not realize the safety of this. Just in one of the networks that I belong to, there's over 14,000 cases, 2 adverse events, none of those related to stem cells. It's a very, very safe protocol. When you look at, if you're looking at total hips, you're looking at 7 to 22% of the people over the age of 60 are going to have some kind of complication and post-operative pain. So that's a much higher number, and those complications can be life-threatening or it could be much more painful. So this is a very, very safe procedure. If you're waiting for this to be covered by major insurance and Medicare, it's going to be years or decades from now. And one of the things that we do know is that if you wait long enough, yes, things happen, but if you wait too long, you're going to find that your condition is going to progress and get worse, and eventually you won't be a candidate, and you might not be around anymore. It's going to take a while for this to become mainstream. Most people do not understand how affordable these procedures are. We have procedures in the hundreds, some in the low thousands, some in the moderate. We have payment plans. A lot of our offices have payment plans. And we have regular people coming in. We have cashiers. We have people working, installing air conditioners. We have doctors, lawyers, engineers. We have all types of people that come in. And the protocol is very cost effective, and when you add up your copay and deductibles and insurance when it comes to total joint replacements, it's not that cheap. And then if it doesn't work for you, then that's not a very good situation for you at all. So today we're going to discover how stem cells and regenerative cells could eliminate your joint and muscle pain so you could avoid surgery. You're going to learn why they're not created equal. You're going to learn how these procedures are performed. You're going to learn if this treatment is right for your condition. And at the very end, like I said earlier, I'm going to give you an opportunity so you could talk to one of our patient health centers doctors so you could discuss your specific condition with them at no charge on the phone to see if this is even worth pursuing. Now we're going to get to the house rules. So no cussing or swearing in the chat box. That should be kind of a given. Another one, no questions until the end of the presentation. I'm doing this presentation right now. I'm trying to run the controls, I'm trying to run the slides, and I'm trying to pay a little bit of attention to the chat, and I have to write down your questions as they kind of come in, so it may distract me a little bit. So if you could just save your questions towards the end, that'd be great. And probably the best thing to do is to do a one-on-one consultation because we are on a little bit of a time crunch right here. So write down your questions as they kind of come in. I'm going to do my best to answer them in the talk. And I've had a lot of questions in the past, so I should be able to answer most of them. Also, due to privacy regulations, I will not be able to discuss your specific condition in front of others. So I will be able to make general answers, but I can't do specific ones due to HIPAA regulations. So I have a disclaimer to make. So when I go through this presentation, it may sound like stem cells and regenerative cells are a panacea for everything, that they could cure everything, even bad cooking. It's not going to do any of those things, and it's not going to make you a better cook unless you can't cook because you can't stand because of the pain. So I think stem cells are amazing. I actually have had them done myself on my neck, my low back. I've done my hair. I've done my knee. It's done very well. I've done my parents, done my brother, my partner's done his uncle, his wife, and stuff. So like we believe in this 100%, and for the right type of case, it's a very good treatment. So I think it's amazing, and hopefully you think it's amazing by the time we get to the end. So why would you do stem cells over surgery? Like I mentioned earlier, I had stem cells done on my knee and my back. I'm not quite that old, but I have some wear in there from previous injuries. I know exactly what's going to happen to me 15 to 20 years from now, and I'm 100% positive I don't want to go down that surgical path. Um, in very rare instances, there is death. Many times people are just going to be worse off than they were before they had the surgery. Or a lot of people think that they get the surgery and they're going to be 100% pain-free, and that's not really the case. Even if you look at common hip and knee replacements, there's a decent amount of the people that are going to have pain afterwards. Some people are going to have severed nerves or stretched nerves. Just one of the patients that came in for a consultation this last week, he had a routine back surgery. They accidentally nicked a nerve, and now he has permanent erectile dysfunction for the rest of his life. Some people get cracked bones, blood clots, infection, allergy to components, scar tissue, and like I said earlier, a lot of people just won't have 100% pain relief. So this may be the case, and after we evaluate you, we may just tell you that, you know what, you have to get surgery, and that's really your only option. I hope that's not the answer that we have to give you, but sometimes it is. So I'm just being realistic. So I think that, stem cells is something that you should investigate, but it's not an answer to all your problems and prayers. So let me just discuss our 3 pillars of treatment with you. So the first thing that we do is just correct diagnosis so we could deliver the right type of regenerative cell. Next thing we do is regenerative medicine to repair and reduce inflammation in your joint. And then we have to deliver those stem cells and regenerative cells in the correct area under correct imaging. So, correct diagnosis. As Dr. House would say, diagnosis is everything. Without the right diagnosis, we can't come up with the right treatment. So, let me just go over a common thing, such as back pain, since 4 out of 5 Americans are going to have an episode of back pain. Even I had an episode of back pain after a head-on accident, and it's very common, and it's a very common thing that people come into our office for. If you're over the age of 60, there's a very common cause, and that's going to be this facet problem. So there are these joints over here. They're guiding joints. They prevent your vertebrae from sliding forward and back from too far, twisting too much. And if it goes forward and back too far and twists too much, it pinches on that spinal cord. So if you're one of these people that gets up first thing in the morning, you're stooped over, takes you 5 to 30 minutes to kind of straighten right up, and you have this dull ache across your back, and very rarely it can radiate down the legs, but not like a nerve pain. It's not like a pinched nerve. It's usually this facet pain, and it's just this dull ache across the low back or in the neck and kind of like upper trapezius, kind of up into those shoulders. And that's going to be your facet pain. It's probably the most common one of anyone over the age of 60. And then we have the scapegoat of neck and back pain. We have the degenerative discs. The reason why it's the scapegoat is it's the easiest thing to see on an X-ray, MRI, or CT. So we have a lot of patients that come in and say, I got pain because I got a degenerative disc. And yes, you may have that, but most of the time I find that it's not really the cause of your pain. And then we have the bulging disc. This is a real easy one. We walk into the exam room, patient standing there because they can't sit because it hurts. Because when they sit, it puts pressure on the nerve and it shoots right down the leg. Very easy thing to diagnose on an MRI, CT, and during an exam. And then we have the elusive spinal stenosis, which is what Gus had earlier. He had multiple disc bulges pushing into the canal right over here. And then, we put stem cells to the discs right over here, got him to suck back. And he did very well, and he was able to stand and obviously make it through rounds of golf and twist on his back without pain. So these are people that can hold onto a shopping cart and walk for hours, but if they have to stand still, their legs get tired and they have to sit down. And then we have the standard lower cross syndrome, which is a combination of muscle imbalances. This is where physical therapy works great. And then we have the sacroiliitis, which is pain here in the pelvic bone, hurts back here in the back of the hip. You go to your doctor, they get an x-ray, they take a look at your hip joint over here, looks okay, and they say nothing's really wrong with you. And it's really coming from a problem in this pelvic joint over here. So there's a lot of kinds of back pain, and I just went over some of the more common kinds. So that was correct diagnosis, and that's one of the things that we do well. Which brings us to pillar 2, regenerative medicine. So I went over a lot of kinds of back pain, but there's one thing in common, and that is inflammation. So a lot of us hear the word inflammation, but we don't really know what it is. And if you want to know what it is, you could take a metal wire brush like this, start rubbing it back and forth against your skin, and eventually your skin's going to get red, raw, and inflamed. Painful, yes. So if your doc tells you that you have too much inflammation in your hip, knee, shoulder, rotator cuffs, in your body because of fibromyalgia, or in your back, it's essentially looking like this, and that is too much inflammation. So you go to your doctor, your family doctor, and they want to help you, and what's the first thing that they do? They give you some anti-inflammatories like Aleve, ibuprofen, Motrin, and yes, it's going to help you reduce your pain, but it's not really a good long-term solution. Because if you're suffering from chronic arthritis, chronic wear, a chronic meniscus tear, when can you stop taking those medications? The answer is never. So what if you could repair these joints so it doesn't get inflamed anymore? So what would Dr. McCoy offer you for joint pain? So some of you guys may recognize Dr. McCoy from the USS Enterprise on Star Trek. He was a doctor of the future, and I think that a good doctor is really a good teacher, and being a good teacher is someone that could explain things with simple analogies. And an analogy I like to use for arthritis is with a board. So if I take a piece of wood and I leave it outside for a long time, eventually it's going to rot and it's going to start to decay. And the reason why they call arthritis joint decay or degenerative joint disease is that it's like degeneration of a piece of wood. So picture this new board over here, like this one over here, and this old board over here, like this. And that is an arthritic joint. However, an arthritic joint usually doesn't cause pain until it gets inflamed. So like that red, raw skin over there. So if you looked at a knee joint that looked like this, it's obvious that it hurt. But if it looks like this, it's not as obvious. It's obvious to me when I look at an X-ray, MRI, or CT, but maybe not to you. So we have a lot of people that come into my office and or other offices throughout the country, and they say, it's like, you know what, the pain just came out of nowhere. I don't know where it came from. And what usually happens is that they have an arthritic joint like this in their hip, knee, back, shoulder, wherever they have it in their body. They do some kind of activity, they overdo it, and they flare it up, and it gets inflamed. Then usually what happens is they manage it with anti-inflammatories or a cortisone injection. It looks like this. They keep going back and forth like this, and eventually it becomes too much, and you get too close to the bone, and it hurts all the time, and it looks like this. And that's when most of the people kind of come into our office. So it's a red, raw, and inflamed arthritic joint. It's very painful. So Dr. McCoy is a preventative doctor. So he would first tell you about platelet rich protein. That's the thing I discussed at the very beginning. Very simple procedure. We do a blood draw, and then we isolate the growth factors out of your blood, and we inject it into the joint. And it would be an arthritic joint like this. And there's a couple theories on how this works, but we know that it's a high concentration of growth factors. And what it does is it lays down a fibrous layer of scar, which will act as an artificial cushion and also reduce inflammation. It also increases the tensile strength of the muscle fibers, tendons, and ligaments, and it's really going to help you reduce pain. It works with aesthetics because it helps tighten up the fibers in the skin, so it's going to make you look younger. So that's PRP, and this is a procedure that costs in the hundreds of dollars. And at the very end of this, when you hang on and schedule your appointment, you'll be eligible to get a free one of those when you get a PRP or any other regenerative procedure. So let me share one of our stories over here.
I was looking forward to a great retirement. I just retired and was ready to go and travel and do things. Unfortunately, I had pain in both knees. They were so swollen I could hardly bend them. And I lost the range of motion and mobility. There was no, basically it was sitting at home watching my life pass by me. In a magazine that I was reading, I found out about Desert Medical Care, and they offer stem cell therapy. And I gave them a call, went in and had a visit with them, and they said I was a candidate to have both knees done. Here I am a year later, and I am so impressed and so thankful. Both knees are really great, and I'm back to being active in my own life, dancing and going on cruises. It's just fabulous. I would recommend them to anyone.
So like I said, that's a very common story, arthritic wear, getting into retirement and unable to do the things that she wanted to do. And things like PRP and stem cells was an answer for her. So let's get into stem cells, because this is essentially why most of you guys have attended this presentation over here. Essentially, there are two kinds. There's embryonic, which come from aborted fetuses, and there's adult mesenchymal stem cells, which come from grown-ups. And the reason why there's a buzz about stem cells is they have a regenerative ability. And the easiest way I could explain this is that it's a cell that you started out in life as. A long time ago, mom and dad donated 23 chromosomes each to make one tiny cell inside your mother's womb. Over time, that replicated and grew into your eyes, your ears, your nose, your heart, your liver, your lungs, your pancreas, your spine, your hips, your knees, your cartilage. And that was an embryonic stem cell that can grow into any type of tissue. Adult stem cells come from the mesodermal layer, which all that means for you in plain English is that it can regenerate things in the mesodermal layer. So it's going to reduce inflammation, it's going to fight cell death, will grow new muscle, it will grow new bone if you need it, it will grow new fat, which would be only interesting for aesthetic procedures. It's going to grow cartilage, it's going to self-replicate, it's going to grow meniscus, tendons, ligaments, and it actually will even regrow nerve. It will have a repair effect on organs, and as of now, it's really the best thing that we have for organ repair, and that's still being investigated today. So, sources of adult stem cells. They're found all over the body and the umbilical cord. A lot of people confuse umbilical cord for the fetus, and it's not. This is birth tissue that is thrown away at the end, and now it's donated to science. Bone marrow, which was really actively used in the very late 70s and early 80s at the beginning. We have fat, which is an abundant source of mesenchymal stem cells, originally discovered and used in veterinary medicine in 2006, and then brought over to the US in 2010. So it's a very effective source. And then, like I said earlier, donated birth tissue. So you got umbilical cord, you got placenta, and you got amniotic fluid, which you're going to get into here in a bit. And the beauty of all of this is there's no moral, ethical issues with any of these. So when it comes to procedures, there's essentially two kinds, autologous and allograft. Autologous means it comes from your own body. It's pulled out and pushed back in, typically that same day. It's going to really be coming from bone marrow, or it's going to be coming from fat. Then you have allograft, which comes from someone else, and that's going to be your placenta. It's going to be coming from your placenta. It's going to be coming from the fluid that surrounds a baby, such as the amniotic fluid. It's going to be coming from the umbilical cord or the cord blood. So this is donor tissue. It's very safe. So the FDA is not regulating stem cells, but they do regulate the safety of the stem cells. So we can't take, go down to the local hospital, find a mom that's having a C-section, take their birth tissue, blend it up, mix it with some PRP, and then put it into your body. We can't do that to you. Because if that mom had hepatitis or HIV, you would now have that. So there's a 9-step process that the FDA requires companies to sterilize. So this is donated, then it's taken, then it's sterilized, and then it's sold to clinics like ours and others throughout the country. And then you have the autologous, since it comes from your own cells and your own self, you don't have to run it through that sterilization process because you're not worried about transferring disease to yourself. So essentially that's the two kinds. There's pros and cons to each of these, and it's really a case-by-case basis. So I don't want to labor on this point throughout the webinar. When you're on your call, or one of the PHC doctors will discuss your specific case with you. So another question I always get is, will this grow cartilage? And it does. This is a before and after. That's lack of cartilage. this is new cartilage, and this is 4 months after a stem cell treatment. And there's a little bit of BS out there. Some people say it's not out there. I've seen news articles published with this. There's before and after MRIs, X-rays. There's even studies done with dogs where they did a post-arthroscopy to show that there's actual cartilage. Studies done with a before and after MRI. So these do grow cartilage. The main thing you got to determine is if you're actually getting stem cells or not, and we're delivering stem cells when we tell you. Third one is proper deployment of the stem cells or regenerative cells. So one of the first methods that's been out the longest is IV. IV's been used for many, many years because it's really the easiest method. The reason why IV works is that the stem cells will have a homing signal on them. So when you have damaged tissue in your body, you have something called a cytokine response. And it's a signal that the stem cells are drawn to. So this is a study where they did a SPECT scan and they marked the stem cells with a radioactive dye, and they found that the stem cells were drawn to these areas that had damaged tissue. So that takes about 7 to 10 days to occur, and that's how IV therapy really works. So if you have enough inflammation in the tissue, the stem cells will be drawn to that, and that is the homing mechanism, and that's how IV cells work, because everyone wants to know, how does it know where to go? When we do injections, we're typically going to do them under ultrasound or fluoroscopy. If it's outside of the spine, we're going to be usually using ultrasound. And if it's in the spine, we're going to be using fluoroscopy or CT guidance. That would be a needle going into the spine because we need a clearer picture with those ones. Autoimmune, this is going to be something on the horizon. There's a number of different studies doing a variety of autoimmune cases. Autoimmune seems to do very well. The exact mechanism and how this works is yet to be discovered. Autoimmune is basically where your immune system attacks its own organs, and the names, different names, depends on what kind of organs it's attacking. So you'll have fibromyalgia, Hashimoto's, lupus, scleroderma, rheumatoid arthritis. So we have our Laura that kind of discussed her case, and she had rheumatoid arthritis, and we had a psoriatic. We do know that autoimmune does very well, and some of our centers are treating it, and some of our centers are not treating it. This is, it's still being researched, it's still being discovered, and I think that this is going to be part of the future for autoimmune treatment protocols. So this would be a one-on-one discussion at the very end. So neurological, again, is going to be on the forefront. So there's a number of studies going on where they're doing multiple sclerosis. Multiple sclerosis is an autoimmune condition, seems to be doing very well. Neuropathy will actually do quite well. There's different protocols for that, and that's an entirely different presentation in itself. So that would be a one-on-one conversation, so I don't want to labor on neuropathy. So if you have questions about neuropathy and regenerative cells, that's going to be a one-on-one call. There's some studies with Alzheimer's and dementia showing some promise. This is an area that can be debilitating for family members. And in the future, stem cells may be a part of the normal protocol for Alzheimer's or dementia. Strokes seem to do very well if you catch it within that 100-day period. And brain injury, there's a number of different studies going on right now when it comes to traumatic brain injury, concussions. I know the National Football League, the National Hockey League, and FIFA, they're funding some studies when it comes to traumatic brain injury, and they're showing very favorable outcomes. The rat studies that I've seen are doing very well, and you know, in the future this may be a common protocol that we do for brain injury. As far as aesthetics go, some of our clinics are doing this. This is a very low risk procedure, and this may be an alternative to a facelift, or if you've already had a facelift and you don't want to look windswept with that second or third facelift, this may be the procedure for you. Essentially what it is, it's a bunch of micro injections, and you're creating a micro trauma in the face, and it's going to reduce fine lines. It's going to get rid of the bags underneath the eyes pretty much within the first 2 to 3 weeks. It's going to lessen the wrinkles, improve the elasticity, and improve the glow, because all it's doing is making your skin look younger. And this can be done with PRP. It can also be done with stem cells. So again, this is a case-by-case basis. Some of our clinics are offering this treatment. Some of our clinics are not. I can't answer for all the clinics throughout the country, so the best thing to do is to schedule a call, and that call is going to be scheduled with your local patient health center's clinic. Hair is another procedure that a lot of our clinics are doing, and essentially these are micro injections, and it takes about a full year, and this is really a good treatment for women because they don't have the alternatives like Propecia. For the men that don't like taking Propecia or finasteride, which is the generic name, it's like myself, like I mentioned earlier at the webinar, I didn't want to take Propecia and finasteride because there's a class action lawsuit. There's some people that have developed permanent erectile dysfunction. One of the theories on why this is happening is it decreases your receptors in your body's ability to receive testosterone, leading to more female characteristics and erectile dysfunction. So I know that probably is very rare, but for me personally, I decided that I would rather not take that risk and do the stem cells, hence the reason why I decided to do stem cells for my hair, and it's done very, very well, and I've been very happy with it. Sexual function. So also known as the P shot and the O shot. So this is a procedure where you could use PRP stem cells or growth factors, and any woman over the age of 30 is going to have these problems. So any woman over the age of 30 that's had a vaginal birth is going to have some level of incontinence, stress incontinence. And then these are going to be, a little bit of leakage when you sneeze, jump, or laugh. This procedure works in 80% of the women, and it's going to be regenerative cells injected into a spongy tissue in the vagina, which is going to help build up the vaginal wall, help build up the musculature, improve the lubrication, and it's called the O shot because it leads to more frequent orgasms, which we haven't had any complaints about yet. So this procedure is, it's a very basic procedure. Essentially, there's a numbing ointment that can be applied in this area, or it can be done with the dorsal block, and then the spongy tissue back here is injected with the regenerative cells or the stem cells to help build that up, and it actually helps a lot with clitoral stimulation. So, for the men listening to this, or the women that have husbands that have issues with this, this is much more common. A lot of men will deny this problem. Stats are 40% of the men over the age of 40 will have some level of erectile dysfunction. If you ask a man and you had every man in the country put their name on a survey, it would be 0%. But if it was an anonymous survey, you're going to get a much closer outcome. And this is really a male vitality shot, also known as a P shot, invented by Dr. Charles Renau. Very similar concept as the O shot. And what this is it's regenerative cells injected in the penis after it's been numbed. It's a painless procedure. And then after about a 6 to 12 week period, the penis tissue is going to grow in thickness. It's going to grow in length. It's also going to improve the circulation, and it's just going to bring the man up on the erection scale. It works very well for the majority kinds of erectile dysfunction, which are related to cardiovascular or diabetic conditions. So for our typical patient is going to be that 50-plus man that's maybe has hypertension, maybe a pre-diabetic, and they have slight issues with an erection. They may be able to get an erection, not quite as firm as it used to be. They're able to penetrate, but they lose erection shortly after penetration. We have some of the men that can't penetrate, and it's a very good procedure. Doesn't work on 100% of the men, but 4 to 5 men will see a difference. So for an 80% chance, I say it's worth it. If you're not a candidate, we will let you know that. And again, this procedure is not done by all of our centers, but when you get on the phone, you get to ask them. So one last story before we close.
So now we're coming up to near the end. So we have Laura over here, autoimmune case. Let me share her story.
Have you heard of stem cell? I was born with rheumatoid arthritis, and this treatment definitely works. At 57, I was all but chair-ridden. I found Desert Medical Care, and they do stem cell. I did stem cell 5 months ago, and today I can kneel, I can walk. I have not been able to do that in 20 years. It has been fantastic, and I am so grateful to have found stem cell and Desert Medical Care.
So like I alluded to earlier, there's a number of our centers doing autoimmune, a number of them do not. Autoimmune is going to be a little bit more in the forefront. It's when your immune system attacks itself, and essentially what the theory is that these stem cells are turning back the hands of time. And for a lot of these people that are coming in for these treatments or these trials, it's they don't do well with the biologic medications that suppress their immune system. So, like I talked about at the very beginning of the presentation, I talked about how you could get a free PRP. We talked about how it can work for aesthetics, how it can work with pain, and how you are eligible to get a free one since you've made it this far in the webinar. So how do you turn today's information into a better life with less pain? We talked about our 3-step system, which is proper diagnosis, extremely viable stem cells or regenerative allografts based on your condition, and the proper deployment of them into the correct areas. Before I tell you who our procedure is for, let me tell you who it's not for. It's not for anyone that's looking to get the treatment covered by their HMO and doesn't want to pay 1 penny out of pocket. It's also not for someone that's not willing to invest even the smallest amount into their health. Because insurance covers traditional items such as physical therapy, cortisone injections, and pain medications, but it doesn't cover new regenerative procedures, even things like PRP. Like I said earlier, the PRP is going to be in the hundreds of dollars, and you're going to get a free one since you watched this webinar with the purchase of one. And then we have other ones in the very low thousands, and some in the several $1,000 mark. And we have regular people that work at the post office that install air conditioners. We have, very affluent people that come in for this procedure, but most of the people are just regular Joes that don't want to suffer anymore. Now that I told you who this procedure is not for, let me tell you who it's for. It's for someone that wants to eliminate the pain, eliminate the cause of their pain, and not go under the knife. This is a person that wants to stay out of the operating room and does not want another surgery, doesn't want a surgery. Even if you've had a surgery, this may be the solution for you. This is for you if you want to wake up feeling better, looking forward to the future like Gus, rather than becoming a burden on your family. His wife had to drive him to all his appointments. His wife had to help him on and off the toilet. His wife had to run the errands, do the grocery shopping, install a light bulb. He couldn't do anything other than sit in a lazy boy chair, and he lived on pain pills, and his pain shots weren't working anymore. So for him, his quality of life was just nothing. So what do you do now? Well, like I suggested earlier, is that you schedule a 10-minute consultation with one of our doctors. It could be me, it could be one of our doctors, and we will determine if it's even worth pursuing an appointment and gathering up your health information. If we think that it's flat out 0% chance that you're going to get better, we will let you know that. If we think that a regular traditional treatment that you don't know of is best for you, we will let you know that. And if it turns out that you are a candidate and you come in and you get one of our procedures, we're going to give you a free PRP since you watched the webinar. So that's what you do next. And this offer is for today and today only. The reason is that we have a certain amount of allocated slots per month for these procedures, and we have a certain amount of allocated slots for these free PRPs that we give out. It's essentially first come, first serve. So my suggestion is that you book that consult and not delay and not procrastinate, because at the end of the day, we want you to have a better quality of life. We want you to stay out of that operating room. As far as costs go, we could discuss that on the phone. If we think it's a PRP growth factor treatment, that's going to be in the hundreds of dollars. If it's going to be a stem cell, it's going to be, somewhere in the thousands, very low to several. As far as insurance coverage go, a lot of our providers take a wide variety of insurances. Sometimes we will integrate some insurance covered services, such as physical therapy, with our treatment. So, we can answer some insurance questions there on the phone. As far as guarantee go, there's no guarantees in anything, just like there's no guarantee in a pain medication, a cortisone shot, or a procedure. But we know that the risks are very minimal. We know that the risk of this is really nothing dramatic. We know the risk of surgery can be severe or life-threatening. As far as taking action, I can't make that decision for you. I will guarantee you that if you leave this condition alone, it's just going to get worse. And not taking action is only going to lead you up to a point where this may not be an option for you. Because at the end of the day, we don't want you to be a burden on your significant other. Whether you're a grandparent or a parent, we want you to be able to not be a burden on your family and spend time with your family. Take those trips to spend time with your grandkids or spend time with your kid, and so you could grow old and become a grandparent and spend time with your grandparents. Whatever your reason is, I'd love to talk to you, or one of our doctors would love to talk to you. It looks like we've run out of time. Thank you for attending, and remind us about the PRP. We have a certificate and have you down on the list, so look forward, and God bless.